Again, for the media who are watching us, remember to submit your questions in the question dialog box. And a special welcome to folks who are joining us on Rogers Television, Rogers Facebook, the Rogers YouTube channel, as well as listeners to Global News Radio AM 980 CFPL and on the CTV London website. We'll hear from the Mayor, the Warden, and then Dr. Mackie. But first, London Mayor Ed Holder.
Well, thanks, Dan, and good afternoon, everyone. Earlier today, I announced more than 40 outdoor festivals, events, and gatherings were postponing or canceling their events here in London over the coming months. That includes Sunfest, Rock the Park, and Home County Music and Art Festival, all three of which are postponed until next summer. Throughout all of this, we've had discussions, and I'd like to applaud all the organizers who made the difficult but absolutely appropriate decision to place the health and safety of Londoners and visitors first. My expectation, though, is that Londoners will honor these community-minded organizers by returning in droves and in record numbers next year when these festivals return. I certainly appreciate the financial impacts it has in terms of these event organizers, in terms of the merchants, in terms of our retail community that is so impacted by this. But I thank them all for understanding and for those event organizers for their leadership. Separately, just a short time ago, the Premier released a framework for reopening Ontario. It should be noted there's no specific timeline on when the reopening will begin, but when it does, it will be an extremely cautious but very deliberate approach. Look, we're still reviewing the Premier's framework while also preparing our own strategies here in London. And first and foremost, the health and safety of all Londoners will remain paramount and the focus of any decisions that we make. Thanks very much, and let's turn it over to the Warden.
Great. Well, thank you very much, Mayor Ed. It's great to be with you today. I want to start by jumping off what Mayor Holder just said and talk about, the work that still needs to be done to make sure that this curve that we are doing such a great job of flattening, that we continue to flatten. And I want to congratulate all of our residents and businesses in Middlesex County who have really worked hard to adhere to the protocols of physical distancing that have been laid out for us. I think we've done a great job. It's hard work for sure, but we're certainly seeing those results. I also want to make mention at the county, we have put together quite a resource book that can be found on our website at middlesex.ca. And in it, we've put together all of the information out there, whether it's health-related information, whether it is any information from the province or the federal governments with regards to the programs that they have started to put forth. And there's also information about a economic resiliency task force that we have started in the county. And I'm excited to announce that we have this the task force is up and running, and really it's a three-stage approach, and the end result will be helping with the recovery of the economic situation in the county. And lastly, with regards to the festivals and events that we find in the county, in Middlesex County, I've heard from a number of different municipalities and organizations this week, and announcements regarding the future of those should be happening in the coming week or so. So I would encourage you to watch for those announcements either through municipalities or through the organizers themselves. And with that, I'll turn it over to Dr. Mackie.
Thank you very much, Madam Warden. And to you and the Mayor, I want to again say thank you. How important your voices are on this at a time when we do have leaders in other places that are trying to minimize the damage that coronavirus has had or demand early reopening of businesses. Your support as leaders of the city and the county is tremendously appreciated. And also I can tell you, it's very validating to every single one of our staff working on the front line, trying to contain this pandemic wave, to hear your voices supporting how important this work is. So thank you very much. Numbers over the weekend, we had some significantly lower numbers, especially over the last couple of days. We only had 2 new cases in Middlesex and London today, which is great news, and 1 additional death today. Over the weekend, the 3 days of reporting over the weekend, we did have 6 deaths. So again, we're seeing the death counts remain relatively high even as the case counts decline. And that's not surprising given that we know that there's usually about a 2-week lag between the peak of cases and the peak of mortality. 5 of those 6 cases where we did have people die over the weekend were unfortunately in long-term care homes and retirement homes. So again, our vulnerable populations there being still quite hit quite heavily by coronavirus. I do want to point to a couple of things on the Middlesex-London Health Unit website, healthunit.com. I happen to have it right here for you in case you need it. But healthunit.com, we have added some additional reporting. We've got the number of cases by lower tier municipality reported now. We also have additional information about each case of mortality, and we have epi curves, so cases plotted by both report date and by symptom onset date, both of which helped to understand the progression of this pandemic wave. So hopefully folks will find that useful at healthunit.com. Big change provincially. There was a small opening in what we at the Health Unit would consider an essential service being brought back online, and that is around community gardens. So both in the city and in municipalities in the county of Middlesex, we will see community gardens opening up over the next few weeks. For the most part, those don't open before May 1, so it is between now and then that we will be working with as municipal officials to make sure that when community gardens are open, they're done as safely as possible. Community gardens for many people are as essential as grocery stores. They represent both food security and an affordable food source. So something that very much has positive health benefits, and we believe it's something that can be done quite safely as well. That's it for me today. Happy to take any questions.
Well, thank you very much, Dr. Mackie, Mr. Mayor, Madam Warden. We do have some questions lined up already, and we'll get to those right now. Mr. Mayor, the first one is for you, and it's from Dan Brown at the London Free Press. Is it your sense that crime has gone up in London over the last 7 weeks? What is your message to business owners who are worried?
I've had a number of conversations with Police Chief Williams on this specific issue. You may know I'm on the London Police Services Board as well, so I have some sense of what the situation is. The chief would tell you that in actual numbers, that since the pandemic occurred, there has not been an increase in the number of crimes generally, and in fact, with more people home, there have been less crimes specifically around people's homes, and that's self-evident by virtue of people attending in their homes. As far as the issues, though, as it relates to business crime, one of the things that we're mindful of is that there are always those situations where businesses, particularly being empty in a number of cases with the pandemic, are susceptible to vandalism or being broken into, whether someone is looking for a place to sleep or has other intentions. And I know that a couple of arrests were made in the last week, and I think that's good news, not for those arrested, but certainly to help stem the issue. I also know that the police have done more in terms of patrols, be it on foot or be it through cruisers, and I think that's important because they've paid particular attention, I would say to you, in the downtown area along Richmond Row and along the downtown area and Dundas extending out into Old East Village. We think that's had some impact, but police presence is always important. And it's certainly a component of our core area action plan, which is intended to have more police presence on the streets. So I would say in total numbers, no, but in specific areas, it's why we've continued to monitor and increase our police patrols.
All right, thank you very much. Mr. Mayor, Dan has a follow-up question. He would like to know if any fines were issued over the weekend.
There were 2 fines issued over the weekend, one for a business and one for an individual. In the case of the business, it was one where previous warnings weren't helpful. It was deemed a non-essential service where individuals were able to walk into the retail environment and not acceptable. So a fine was levied. And an individual was also fined this weekend. And again, I'm going to stress that one of the things that we've heard consistently through the medical officer of health is not just self-distancing, not just be mindful of crowds and having that 5-person limitation with self-distancing, but also stay out of the skate park, stay off the tennis courts and the basketball courts, those areas where, frankly, there was a challenge. The fact that there was only one individual charged over the weekend, I think, is very positive news. I think it means that people are getting the message. I want to thank Londoners for that and ask them, even as the weather gets better, to keep their vigilance high, continue to save lives, and you are the difference makers. So we're grateful when people do that.
All right. Thank you very much, Mr. Mayor. The next question is for Dr. Mackie. Dr. Mackie, this question is from Sophia Rodriguez at CBC London. What advice will you be giving businesses when it comes to reopening the economy? In particular, how do you balance public health with the need to repair a damaged economy?
Well, I would start by saying that the economy is an important driver of our wellness and health in our society, and that when people are working and have stable incomes, that improves their health, reduces their stress, and makes them healthier in a number of ways. So I don't see the two issues as being in conflict. What we have really right now is a balance between short-term pain and long-term gain. Keeping the economy closed for now, except for essential businesses, is going to allow us to get through this pandemic wave and allow us all to be healthier, including our businesses to be healthier in the long run. The big thing that I would say to specific businesses right now is think about how your business can enhance the physical distancing between your customers and your staff, because we know that when businesses reopen, customers will be looking for those ways to maintain the physical distancing measures that we know help prevent the spread of coronavirus, and also influenza and any other number of diseases, infectious diseases in the community. So I've had some restaurant owners asking me what can they do to help protect their staff. Should they be reducing the number of seats? Should they be putting up baffling or temporary movable walls? Those sorts of things. Absolutely, these things can help make a difference, and whether they're required or not, you will have some kind of competitive advantage if you're able to take those measures into place. I remember growing up, my dad loved to take us to Bonanza because you could get a meal for a family of 4 for under $20, and it was lots of good healthy options. We also didn't have sneeze guards over the salad bar at that time. So, that's now something that is required, and that's really made a positive difference. And you will see those sorts of innovations in both, equipment, space, and in terms of processes and how we interact. And if you can be ahead of that curve, that'll be so much the better for you.
All right. Thank you very much, Dr. Mackie.
Dan, sorry, I don't know how to say this, but the only Bonanza I remember had Lorne Green and Haas. So I'll trust Dr. Mackie to come up with those other choices.
There we go. Well, thank you very much, Dr. Mackie, and bring back a few memories for folks, I think, too. All right, let's go back to the questions. Madam Warden, this one is for you. This is from Dan Brown at the London Free Press. Any more news of fines in the county? Last time you mentioned one charge. Is that still the only one so far?
Well, thank you very much for the question, Dan. And yes, that is still the only charge that has been laid in the county, and that was a couple of weeks ago. And proud to say that the warnings that have been given, people have listened. So again, congratulations to restaurants or to residents and businesses in the county.
Thank you very much, Madam Warden. Dr. Mackie, Sophia Rodriguez from CBC has another question for you. Today, the province said Ontarians will be transitioning to a new normal. From a public health standpoint, what do you think that will look like? Do you think things will ever go back to how they were before the pandemic, or will our practices and mindset be forever changed?
There's no doubt that we will see a wide variation in how people respond to economy reopening and to the removal of the strong physical distancing measures that have been in place. We know that there will be some people who are rushing back into, those intense contact situations that really have been craving that human contact. And also there will be others who choose never to go back to the way that they lived before. An obvious example is if you saw somebody walking through, downtown with a mask over their face 6 months ago, you would have thought that person's crazy, or maybe they're from somewhere else where that's normal, but that's not normal here. And now I don't think we will bat an eye when we see those sorts of things in public in the future. And hopefully we recognize that if that's happening, it's probably somebody who's, wearing a mask because they're ill and doing so to protect the people around them. And that's actually quite a good thing from a public health perspective. I hope that there are some changes. I hope that we can think very carefully about those high contact situations. I hope that we can, as a society, embrace some of the culture that we have around gathering in public without necessarily, being right in each other's physical space. We are spending a lot of time, many of us, at home, near and around our neighbors, and having great positive interactions that are natural and healthy and good, and not putting each other at risk. So that's a really positive thing. In my neighborhood, a lot of people on their front porches or sitting on their front steps, and I think that's a really positive culture as well. Eyes on the streets is a good thing from a safety perspective, and it's great in terms of that social cohesion that makes our society stronger.
Thank you very much for that response, Dr. Mackie. Okay, next question from Sawyer Bogdan at Global News Radio, AM 980 CFPL. This is both for Mayor Holder and for Dr. Mackie. It's a lengthy one, so I'll ask you to bear with me as I read through this. Mayor Holder and Dr. Mackie, in a Facebook post, Councillor Michael Van Holst started quoting a California doctor saying that we should stop sheltering in place and all businesses should get back to work. Quoting the doctor, the post also said that the data is saying now that we should get back to work and that there is no science behind closing small businesses right now. The post quoting the doctor also said quarantining the sick is what we should do, not quarantining the healthy. So here are the questions, and there's three parts. First, what is your reaction to this? Two, is there a danger to a community leader sharing information that contradicts the medical advice of the health unit and the province? And then for Mayor Holder, will there be any ramifications on council? And for Dr. Mackie, what's the danger of opening things too early? Are we ready for that? Who'd like to take it first? Mr. Mayor.
Thanks very much. Happy to make some comments. Firstly, I have a lot more confidence in the Chief Medical Officer of Health and his staff here in London, and the Chief Medical Officer of Ontario, and if I may, the Chief Medical Officer in Canada, than folks who do not live in this country and have their own views. I read the same article, and apparently when they say that there's a 0.3% lethality rate, I don't know the legitimacy of their number, but that adds up to about at least 100,000 people dead in California, and that would not be acceptable to me, let me tell you. So from my standpoint, I would rather listen to advice from people who are here on the ground that understand the local conditions, that have a sensitivity to what is going on in our city and in our region. That gives me much more confidence than someone else, and that might be acceptable to some other place, but not here in London. So I'll take my direction from the Chief Medical Officer of Health any day over someone from another vicinity. As far as is it helpful to have that from a leader in the city? Look, One of the things I've learned in my 1 year and almost 5 months in office is that there are a lot of different views from people on a lot of different issues, and candidly, it's not helpful. It's not helpful when we don't take the advice of our local professionals over that of another country, let alone another region. And so, no, it's not helpful at all. And I would remind Londoners who listen in on this and who communicate through our media that it's our local medical officer of health who I think they can place their confidence and trust in. And will there be ramifications? Look, I think the ramifications ultimately will be the world of public opinion more than anything else, as far as whether or not this was appropriate to send out. I don't think it's helpful. I don't think it should have been sent out, but I don't believe that there will be some public flogging as a result of this.
Thank you very much, Mr. Mayor. Dr. Mackie.
Maybe just to add from the perspective of the science on what happens if you open too early, we know exactly what will happen. You have other countries in the world that have chosen the approach of leaving their economies open and trying to shelter people who are at highest risk, whether the elderly or people in hospitals. And the results are devastating. If you look at Sweden, for example, which has been, Sweden and UK have both kind of taken this hands-off approach, and they've seen mortality rates, Sweden's mortality rates almost 4 times what it is in Canada. UK's is many times higher than what we have in Canada. The problem is it's just impossible to isolate those that are at highest risk. So if your focus is there and you're not, paying attention, for example, to school-age children who are at very low risk of dying but are very efficient at spreading infectious diseases, then you're going to see this rip through your community and much greater impact on those who are most vulnerable. So the approach we've taken in Canada has saved lives. I think it's something we all should be very proud of.
Thank you very much, Dr. Mackie. All right. We have another question for Mayor Holder. This one is from Steve Young at CTV London. Mayor Holder, all summer festivals are canceled for 2020. You can't go to parks, malls, or sports fields. What can Londoners do to safely get outside and get moving?
Well, thanks, Steve. We have never said that Londoners should not go outside, and and to be clear, one of the things that they have the ability to enjoy is walking or biking. What we're being really clear on is that we do not want people participating in team-related events or events where individuals congregate. So I think there are some great opportunities for bonding by individuals taking good and long and healthy walks. My wife is writing a book, and it's called Life is a Journey, Keep Walking. And I think this is one of those things where people can take that advice and direction and keep walking, and I think that is important. I think what I've heard too is as I've listened to various media, so families have come together that are within their own homes and done more events together as families who are within their own homes. So is it as broad as when individuals can go outside and enjoy festival activities and the like? Of course not. I mean, because those are great external events that not only just Londoners, but others from outside our great city. And we even have the odd person from Middlesex County come to our festivals and events, which is nice. But I would say to you that look, I think what great leadership has been shown by these organizers who, frankly, have taken some very significantly economic hits as a result of that. Wow. And the broader economic impact I've already discussed. So I think that it's probably more passive activities, although I think a good healthy walk is not necessarily passive, but different than it's part of that new normal you heard the Premier talk about today.
Thank you very much, Mr. Mayor. We don't have any more questions. We've come to the end of our questions, and we're just about out of time. I wondered if any of you would like to make a quick comment before we sign off today. I'll leave it to you. If you want.
Well, maybe I'll jump in, Dan, since I only join this panel once a week, so I don't get the opportunity to extend my congratulations on a daily basis like Ed does for the city. But I really do want to take this time to congratulate all of the frontline workers at the hospital, at the health unit, with EMS, our delivery drivers, our grocery stores. You know, they're the face of how we are battling this episode that we're going through. But not only to them, to their support systems, because I can only imagine when they get home at the end of their shifts that it is emotional and it takes its toll. So, you know, when we're thanking our cashier for bringing in our milk and our eggs and the delivery driver and all that, a special thanks, I think, needs to go out to their support systems because, you know, what we're going through, it's the physical toll and it's the mental toll. And it just seems that we can't get through this without the people that are surrounding us and lifting us up.
Thank you very much, Madam Warden, and thank you, Mr. Mayor, for those comments. Well, that brings us to a close for today. Dr. Mackie, thank you for your time as well. And we will be back tomorrow afternoon at 2 o'clock for our second virtual daily media briefing of the week. Thanks again for tuning in, and we'll see you tomorrow.
Was that 4 or 5? He's lost count and still thinks he can drive. Do you think he knows that when he is caught and charged with impaired driving, he'll lose his license and a lot more? If he gets in his car, he'll face costs exceeding $20,000. Does he realize he could have a criminal record for his choice to drive? And it could be much worse if he crashes. I wonder what he'll be thinking tomorrow.
Have a hold on one at 15.
Visit ArriveAlive.org to find out more. Arrive Alive. Drive sober.
You're watching Rogers TV.